For the 10th year in a row, Beaufort Memorial Hospital was named Most Wired Hospital in the July issue of Hospitals and Health Networks. Ed Ricks, Chief Information Officer and Vice President of Information at Beaufort Memorial Hospital, is here to explain what that accolade means. Ed, what does it mean to be considered most wired?
Well, it's a national award for hospitals, and it's not just on using technology, it's on how you use technology to provide patient care and create efficiencies in the system, and especially how it wraps around patient safety initiatives.
Can you speak to some of those technologies that are in use at the hospital?
Yeah, some of the big things that we've done in the last few years are computerized provider order entry, and people hear about that a lot, but that's actually where the physicians enter the orders directly into the computer system and instead of writing orders and cutting out the middleman. And the nice thing about it is, A, it's very legible, so we don't have the transcription errors that we've had in the past, and things just happen more quickly, and also it allows the computer system to do the decision support. So, for instance, if there are allergies or something like that, the providers know about that while they're doing the orders. A number of other initiatives to sort of make the technology more seamless to the clinicians. That's kind of our goal, is to create the technology to be somewhat invisible and not interfere with the workflow of the providers.
Well, it sounds as though it does benefit those who care for the patient, but it also benefits the patient and improves patient care, does it not?
Absolutely. I think that's always our goal, is not to just have the technology because it's cool, but to actually improve patient care or the delivery of the care process, and so that's always the goal of what we do.
And how would that benefit patient care, Ed?
Well, for sure, your provider knows exactly what they're ordering when they order it for you, and if there are any interactions or no duplicate tests are ordered, because the system will tell them. It speeds up the care delivery process, so as soon as the provider puts in the order for an imaging study or medicine, it immediately goes to the pharmacy or the imaging department for the technicians to do those orders. And also, then the information is available to all of our caregivers immediately. So if you're seen somewhere else, we've got the connectivity to our physician offices. The provider in their office knows exactly what's going on in the hospital, and better continuity of care.
Yeah, it's got to be a huge benefit for the caregiver and the patient as well. Ed Ricks of Beaufort Memorial Hospital, we want to thank you for your time and letting us know about that Most Wired recognition. Thanks so much.
Okay, thanks, Hallie.